One of the most common complications of diabetes is something called diabetic neuropathy. Now, I know medical terms can sound intimidating, but stick with me because understanding this is crucial. Diabetic neuropathy occurs when consistently high blood sugar levels start to damage the nerves in your feet. Imagine your nerves as delicate wires transmitting signals throughout your body. High blood sugar is like static interfering with those signals, causing them to misfire or not work properly. I've had patients tell me it feels like pins and needles, a constant tingling or even a burning sensation. One patient, a school teacher named Sarah, described it as walking on hot sand even when barefoot at home. This nerve damage can make it difficult to sense pain, temperature changes, and even pressure on your feet. And that's where the danger lies. Let's talk about the subtle signs that often fly under the radar. Early on, diabetic neuropathy might manifest as numbness or a tingling sensation in your feet, especially in your toes. You might notice it more at night or after sitting for a long period. It can feel like your foot is asleep, even when it's not. Now, you might think, okay, numbness, not a big deal, but here's the thing. This numbness can mask more serious problems. Imagine stepping on a sharp object without realizing it because you can't feel it. That small cut, which would normally heal quickly, can turn into a dangerous infection because you didn't feel the need to clean it or protect it. That's why it's so important to pay attention to these early warning signs and talk to your doctor if you experience them. As diabetic neuropathy progresses, that initial numbness and tingling can transform into more persistent pain and a burning sensation. This pain can be sharp and shooting, or it can feel like a deep, aching throb. It's often worse at night, disrupting sleep and affecting your overall quality of life. I remember one patient, a construction worker named John, who described the pain as feeling like his feet were on fire, especially after a long day on the job. The pain was so intense that it made it difficult for him to sleep and even walk. This constant pain and discomfort can really take a toll on your emotional well-being, adding stress and anxiety to your life. It's important to remember that you're not alone in this and that there are ways to manage the pain and improve your quality of life. If you have found value in this video so far, please tap the like button. Now for the rest of the show. Chapter 4. Sores and ulcers. Now here's where things can get really serious. Diabetic neuropathy increases your risk of developing sores and ulcers on your feet. These sores, often called diabetic ulcers, can develop from even minor injuries that go unnoticed because of nerve damage. Remember that numbness we talked about? You might not feel a blister from ill-fitting shoes, a cut from trimming your toenails, or even a small pebble stuck in your sock. These seemingly insignificant wounds can quickly escalate into open sores that are slow to heal and prone to infection. And because diabetes can also affect blood circulation, getting enough oxygen and nutrients to the area for healing becomes even more challenging. Chapter 5. Dry, cracked skin. You know how important it is to moisturize your skin, right? Well, this is especially crucial for people with diabetes. High blood sugar can damage the sweat glands in your feet, leading to dry, cracked skin. Think of your skin as a protective barrier. When it's dry and cracked, it's like having tiny cracks in a wall. It weakens the structure and makes it easier for bacteria and germs to sneak in. This dryness can also lead to itching, and scratching those itchy areas can further damage the skin, increasing the risk of infection. So, keeping your feet moisturized is essential, but be sure to avoid putting lotion between your toes, as this can trap moisture and create a breeding ground for bacteria. Chapter 6. Fungal Infections. Let's talk about fungal infections for a moment. We've all heard of athlete's foot, right? That itchy, burning, and sometimes painful condition that affects the skin on your feet? Well, people with diabetes are more prone to developing fungal infections like athlete's foot, as well as toenail fungus. These infections thrive in warm, moist environments, and because diabetes can affect blood flow and weaken the immune system, it becomes harder for the body to fight off these pesky invaders. Now you might think, okay, it's just a fungal infection, I'll grab some over-the-counter cream. But with diabetes, even these common infections can quickly escalate if left untreated. Chapter 7. Ingrown Toenails. We've all been there. The pain of an ingrown toenail. It's enough to make anyone cringe. But for someone with diabetes, an ingrown toenail can be more than just a painful inconvenience. it can be a serious health risk. An ingrown toenail occurs when the edge of your toenail grows into the surrounding skin, causing pain, redness, and swelling. Now, for someone with diabetes, this simple issue can quickly escalate into a serious infection. Why? Because diabetes can impair your body's ability to fight off infections, even minor ones. So, that ingrown toenail, if left untreated, can develop into a more serious infection that might require antibiotics or even a minor surgical procedure. Chapter 8. Corns and Calluses. Corns and calluses, those thickened areas of skin on your feet, are common foot problems that can be particularly troublesome for people with diabetes. They develop due to repeated pressure or friction on the skin, often from ill-fitting shoes or foot deformities. Now you might think corns, calluses, those are just minor annoyances. But here's the thing. For someone with diabetes, corns and calluses can increase the risk of developing foot ulcers. Why? Because these thickened areas of skin can become dry and cracked, providing an entry point for bacteria and germs. And remember, with diabetes, even minor wounds can be slow to heal and prone to infection. So it's important to address corns and calluses promptly and prevent them from becoming a bigger problem. Chapter 9. Slow healing wounds. We've talked about how diabetes can increase the risk of foot sores and ulcers, but here's another crucial point. Even minor cuts and scrapes can take much longer to heal if you have diabetes. Remember, consistently high blood sugar can damage blood vessels and nerves, impairing circulation and the body's natural healing process. Think of it this way. Your blood carries oxygen and nutrients to your tissues, which are essential for healing. But when your blood circulation is compromised, those healing elements can't reach the wound site as effectively, slowing down the healing process. So, what might seem like a minor cut that would normally heal within a few days could linger for weeks or even months in someone with diabetes, increasing the risk of infection and complications. Now, this one might surprise you. Over time, diabetes can actually cause changes in the shape of your feet. Remember how we talked about high blood sugar damaging nerves? Well, this nerve damage can weaken the muscles in your feet, leading to imbalances and deformities. One common deformity is called hammer toe, where the toe bends abnormally at the middle joint, resembling a hammer. Another is bunions, bony bumps that form at the base of your big toe, causing it to turn inward. These changes in foot shape can make it difficult to find comfortable shoes and increase the risk of developing corns, calluses, and those dangerous foot ulcers we talked about earlier. It's like building a house on an unstable foundation. It's only a matter of time before problems arise. Okay, let's talk about foot odor for a moment. It's not the most glamorous topic, but it's important. While everyone experiences foot odor to some degree, excessive or unusual foot odor can be a sign of a problem, especially for people with diabetes. Remember how we talked about diabetes increasing the risk of fungal infections? Well, those infections can cause a distinct, unpleasant odor. But here's the thing. Excessive foot odor can also be a sign of a more serious problem called foot ulcers. These ulcers can develop deep within the foot. And because they're often painless in the early stages due to nerve damage, you might not even realize you have one. The odor is caused by bacteria in the ulcer, and it's a sign that you need to see a doctor immediately. If you found this information helpful, make sure to subscribe to our channel for more health tips and advice. Last but not least, let's talk about color changes in your feet. Now, our feet naturally change color slightly depending on the temperature and blood flow. But if you notice persistent color changes in your feet, especially if they appear pale, bluish, or discolored, it's time to pay attention. These color changes could be a sign of poor blood circulation, a common complication of diabetes. Remember, diabetes can damage blood vessels, restricting blood flow to your extremities, including your feet. When blood flow is compromised, your feet might feel cold to the touch, and the skin might appear pale or even bluish. This reduced blood flow also makes it harder for wounds to heal, increasing the risk of infections and other complications. We've covered a lot of ground today, and I want to leave you with this. Your feet are your foundation, literally and figuratively. Taking care of them is crucial, especially if you have diabetes. We talked about 12 signs you should never ignore: numbness, tingling, pain, sores, dry skin, fungal infections, ingrown toenails, corns, calluses, slow healing wounds, changes in foot shape, foot odor, and color changes. Remember, early detection is key. Don't wait until a small problem becomes a big one. See your doctor or a podiatrist regularly for foot exams. They can help you manage these conditions and keep your feet healthy for years to come.